le roi Danny Fortin.
He commanded Canada's NATO mission in Iraq. Now he's in charge of making sure Canadians get the COVID vaccine.
Major General Danny Fortin will be heading up the logistics and operations within this center. Major General Fortin is a seasoned officer.
In a country as geographically large as ours, we can expect some logistical challenges ahead.
The federal government intends to purchase 7 vaccines, all still in development, all with different approval times, transport, and storage needs. One of the first challenges, picking up vaccine from overseas manufacturers.
C-17 or a C-130J Hercules could do that task.
Dan Ross has experience managing a crisis. He was the defense official in charge of buying and moving equipment on an emergency basis into Kandahar.
Most public servant departments are not trained or equipped to do that type of role. They don't do command control communications. They are normally policy shops or deliver services to Canadians.
The Canadian military was called in to rescue provincial long-term care homes last spring with 1,700 troops. Now, more than 28 of their top planners are seconded to public health.
So I think there's obviously going to be a bit of a trade-off in terms of how much they can watch the rest of the world and engage in detailed planning to respond.
I don't know if this has ever happened before.
This public health expert says having the military so heavily involved and at such a late date is an indictment of health officials who've had 2 decades or more to get ready for a big pandemic.
You know, you spent a lot of time, a lot of money, a lot of resources planning for this, planning for the pandemic. And this is the best that you can do.
How much more involved the military will get is unclear. Public health is still developing its plan. Defense Minister Harjit Sajjan acknowledges it is not beyond the realm of possibility. In some parts of Canada, troops could be running clinics and administering vaccine. Murray Brewster, CBC News, Ottawa.